My quote this year for my ISM presentation was, "You can never cross the ocean until you have the courage to lose sight of the shore." And as I said earlier in the year, I have this in my room since like middle school. It's always been a really meaningful quote to me because you have to always have like courage to take the first step in an unknown territory to like be able to find out what you really want to do and accomplish things you really want to do in life. So I feel like ISM is kind of like that first step of crossing the ocean in order to get to where I want to be as maybe an anesthesiologist or a doctor. So, hi, my name is Michelle Tong, and this year I decided to study anesthesiology because I felt like it really combined my desire to like help people and like improve the lives of others around me, along with like my interest in science and math, and then my ability to like interact with people and talk to those around me. So I did 6 interviews, and my first interview was with Dr. Cynthia Wowers, and she is an anesthesiologist and director of acute pain management service at Texas Scottish Rite Hospital. And this was my very first interview, so going into it I was kind of nervous. But I got there, and the receptionist and the front desk were very friendly, and when I talked to her, she first came straight off the bat and told me Scottish Rite Hospital is very different than most other hospitals that you'll probably go to because they don't have an ER, and so their hours are pretty set in stone, where they like get there at 7:30 and they leave usually before like school gets out for her children, so around 2 or 3. So she said she really liked it because she can spend a lot more time with her family. And she also emphasized that being an anesthesiologist allows her to be in control of the OR, which she really likes being in control. So if you have like that personality that enjoys being in control of the situation and like making decisions like that, anesthesiology would be a good profession. And she also emphasized that having a passion for biology and chemistry helps with being in anesthesiology because that's what you're working with all the time. So if you're really involved and interested in what you're working with, it will help with you doing good in your profession. And then she had previously worked at an ICU at a hospital in Atlanta, and she said she didn't like it there because it comes with a lot of emotional attachment. You spend all this time with these patients that live in the ICU for months, and then they die on you, and you just can't really get over the fact that they're gone. And like I said earlier, she said that Scottish Rite is different, so that she's able to balance her work and family very well, but usually working at most typical hospitals, it's difficult to balance that. My next interview was with Dr. Tiffany Moon, and she works at UT Southwestern, and she's an assistant professor and anesthesiologist, but she usually works at Parkland, which was across the street. And she specializes in trauma and vascular anesthesiology, where she basically takes care of those really, really sick patients or the ones who come in with like gunshot wounds or knife stabs. And she said they actually get a lot of that, which I thought was really cool. Like, I actually wanted to work with something like that because I thought it would be really interesting. And since Parkland is a public hospital, it provides medical care for all types of people in need, like the homeless, illegal immigrants, like anyone. And so it gives her like a sense of gratification that she really enjoys helping people who normally would not get health care anywhere else. But the most difficult part of being an anesthesiologist was it's difficult to deal with an operation going wrong, even when you know you did everything right that's possible, because sometimes there are times when you just can't help the patient, especially when it's trauma and there's an accident, because the patient could be like really sick, and no matter how much you try and help, they still might pass away. And she said for her, she always lived life like basically getting everything handed to her on a silver plate. She like everything went right for her. And then going into anesthesiology, she realized that that doesn't always happen. So that was the difficult transition for her. And I feel like that could kind of be something that would be difficult for me too if I were to become an anesthesiologist later in life. My next interview was with Dr. Charles Witten, and he is the chair of the Department of Anesthesiology at UT Southwestern. He was a little bit different from the other doctors I talked to because he does mainly administrative work and not that much clinical, but I thought it was still interesting to talk to him because he emphasized the need to be able to interact with people and like talk to those in your workspace, because you need to be able to effectively communicate with your patients, the other doctors you work with. And he said it's a very fast-paced and high-intensity job, so you need to be able to keep up with everything that keeps going on. He actually majored in engineering in college instead of like biology or chemistry that people would think they would typically major in before going to med school. So he said that it was really a good idea to try and major in something other than what you'd be studying in medical school, because it gives you like a backup plan in case medical school doesn't really work out for you. You could have another interest that you could follow up as a job if you find that you don't really like medical school. And he actually knew my dad, because my dad was working with UT Southwestern for an anesthesiology project with endotracheal tubes and pulling them out to see which method of taping them in would be most effective. So he was like, "Oh, I know your dad. Yeah, I just talked to him last week." And I didn't know that, so that was pretty interesting. And then my next interview was with Dr. Jimmy LaFernie, and he works at Baylor Medical Center at Frisco, and he's the anesthesiologist there and a VP of Medical Affairs. I have asked him to be my mentor, but he has not responded yet. But he gave me a lot of information. This was by far my longest interview, and I actually had to reschedule about 3 times, which kind of gave me an idea of like, oh, doctors are really busy. You always have to like work around their schedules because it always changes. But he gave me a lot of advice, like making sure I really know if this is what I want to do, because medical school is a long path, and if you're in it for the wrong reasons, like some people want to practice medicine for money because they hear doctors pay a lot. But if that's what you're in it for, you won't really feel like you love the job and you'll be passionate about it. He says you need to have the I can fix it mentality, to have confidence in your decisions in the OR, because if you're just doubtful or unsure of what you are capable of doing, then you probably will not be able to be successful in really solving the problems that you have to do in the OR. He said that there's a large like corporate side of anesthesiology where you have to sign contracts with hospitals, and it's all complicated, and he says it's moved more away from like being able to practice by yourself, medicine by yourself, rather than you have to take into the consideration the interests of all the other doctors you work with. So it's a lot less independent, and it's different than how people usually think medicine is. And he also reiterated the idea that patient satisfaction is a lot more emphasized in medicine now as what the true success is measured as, rather than just purely if the patient survived their procedure. And he said this profession is good if you enjoy spending time with people, because you get to work with a lot of different types of people and talk to them. So if you're an outgoing person, anesthesiology is a good profession. My 5th interview was with Dr. Amy Gruber, and she worked for Anesthesia Resources for Children, and she mainly like centered around Medical City. But she was my youngest, the youngest person that I interviewed. She just recently finished med school and residency 2 years ago. She said she really enjoyed working with kids because of their high energy, and that they're not responsible for what happened to them, like their medical issues, and that they have high energy and are always upbeat and optimistic. But she said the schedule for working as an anesthesiologist is very unpredictable. She only knows where she would be working the night before, because of the place that she practices at. They release like who will be working where the night before. She said being a doctor is kind of like acting sometimes, because you need to like show your patients that it's okay, and you need to like have a good poker face when you talk to your patients. Even if something's going wrong, you need to like comfort them and make sure they know that everything will be okay, even if it feels like it won't. And then her most important point that she told me several times was to pick an interesting college major, because you'll be studying medicine for like 4 years after you get like your bachelor's degree, and then you'll do residency, and then you'll do medicine for the rest of your life. So pick something that you really, really want to learn besides medicine, so you get like another opportunity to do something interesting. And then my final interview was with Dr. Lindsay Grover, and she works at Children's Medical Center in Plano. She emphasized that it has a very unpredictable lifestyle, and just like the last doctor I spoke to, she said that she loved working with kids. You kind of get this gratification, even though they never think to say thank you because they're children and they don't really understand what the doctors are doing for them. She still feels like she's appreciated. She really emphasized that people skills are very necessary, because you could be a terrible doctor, but as long as you know how to talk to the people, like the patients, and get them to like you, they'll probably still like you as an anesthesiologist. She really emphasized that I need to make sure that this is the right profession for me and to do what really makes me a happy person. And she actually did math UIL in high school, which is something I do now, and she said number sense is something that is really helpful as an anesthesiologist because you need to be able to work with numbers well. And so that's actually something I do in high school, and I thought that was pretty cool. And there was this one fact she told me, that it is 10,000 times safer to be in anesthesia, to be under anesthesia, rather than driving down the tollway for an hour. So I thought that was really cool, and it kind of put it into perspective for me of how safe anesthesia has become. And so I kind of summarized some of my research assessments, and then I touched on two of them that I really enjoyed. Overall, I mainly researched articles and studies relating to pediatric anesthesiology because that's what I originally wanted to do. But I kind of changed last minute into just general anesthesiology because Dr. LaFernie, the doctor who I asked to be my mentor, just does general, and I really liked his personality and the information he gave me. So I thought he would be a good mentor, even though I originally wanted to do pediatrics. Most of the articles I read gave me a lot of insight into behavioral effects and health effects of using the type of drugs that anesthesia uses to sedate a patient. So it kind of takes into account of what kind of effect anesthesia has on the patients after their procedure. My fourth research assessment, which is actually pretty similar to Evan's, was about when a mother needs a procedure and she has a fetus, how they use the drugs and how it affects the fetus later on in life once it's born, and that it can have a lot of long-term health defects. And it's not proven that it does affect the baby, but they said it could possibly be correlated. And so it talked a lot about weighing the importance of the mother's safety in anesthesia versus the fetus's and what would be more important. And I thought that was really cool. And then my fifth research assessment was over the UNT trip. And I took 3 courses. One was Biology 2 for science majors, Health Psychology, and Biomedical Engineering. And I actually really liked the engineering class the best because it was showing us how you can make a thermometer that people use when taking the temperature of their patients. And it's not really directly related to anesthesiology, but I thought it was really cool. And so it kind of gave me an idea for my original work because I wanted to tie engineering into my original work. So I decided to redesign an endotracheal tube for my original work. So I really thought the UNT trip kind of gave me good perspective on tying in different interests into what I want to do. So my goals for this year are basically to continue learning more about anesthesiology. I just want to be sure that this is what I really want to do with my life. And then to expand my experience in the professional world through this year in ISM and learn how to properly interact with business professionals and all types of people that I'll need to interact with later on in life. Thank you for listening to my speech, and that's all. How long was that? 14 minutes.